I nominated the Physiotherapy Musculoskeletal Outpatient team for this category. I feel it's an example of a team with a shared purpose to improve the waiting times for patients. I feel this project is an example of collective leadership where everyone took responsibility, from our administration staff, our physiotherapy support staff and our clinical physiotherapists throughout our departments.
Both staff and patients were frustrated with the long waiting times for a routine physiotherapy appointment, so we developed and implemented assessment clinics, starting in one site and scaled up to 6 sites now across the trust, and has improved the waiting time by 12 weeks, as well as improving patient satisfaction with the physiotherapy service.
The reason I nominated David is in relation to innovation he brought to his day-to-day practice, which has resulted in fantastic outcomes in relation to service improvement. David has worked steadfastly in relation to bringing his own ideas with regards to how he could achieve service improvements in the part of the service who he's responsible for. He has worked tirelessly with his management colleagues and indeed his own staff in relation to innovation, which has paid significant dividends in respect of the service and, most importantly, families who he's worked with.
I have nominated Gail Heaney for this award because I would like her to have recognition for all her hard work over the past 3 years, her involvement with tracheostomy patients that were discharged into the community. Traditionally, these patients would have been discharged to a nursing home or would have to stay in hospital due to the high complexity of their condition.
This was never available in the community before, as suction carries many adverse risks and is usually reserved for an acute setting. Our challenge was trying to identify who we could train and how we could train them to facilitate this care in the community. The Band 5 complex care team nurses were trained extensively in the management of this patient and allowed her to return to a daycare setting twice a week and be managed safely, competently and effectively in the community.